Friends, welcome to my workplace at Ranaghat, West Bengal, India. This is a hard cataract. Let us observe nucleus management of this case. By this time, the incisions have been made, the anterior capsule has been stained with type and blue dye, anterior chamber has been filled up with visco, and now capsulorhexis with the help of a utrata forceps. The pupil has dilated up to 5 mm to get an adequate sized rhexis. The capsular tag is guided along the border of the dilated pupil. So we are getting a rhexis of about 5 mm or 5.25 mm. In hard cataracts, never do a rhexis less than 5 mm. Better to go towards 5.5 or 5.75 mm. Nucleus management becomes a lot easier if we do a rhexis larger than 5 mm, but it should not be more than 6 mm. Hydrodissection is done very carefully. Small aliquots of PSS is injected at multiple points, and then the nucleus is rotated very gently. And now some more visco is used to fill up the anterior chamber, and then this is the time to introduce the tip of the phaco needle. The exposed part of the needle should be this much, about 2 mm. And now the tip goes bevel down. Some superficial cortical lens matter is removed to expose the nucleus, and now this improves visibility. Now the handpiece is turned to make the bevel up, and now push the nucleus little down and go into the substance of the nucleus just in front of the main incision, and travel through the nucleus towards the opposite equator. And this technique I call submarine chop. It resembles a submarine going through water. And as it reaches near the opposite equator, the chopper is used to separate the two heminuclei. In this case, it was a very tough, hard, leathery nucleus, but we have got a very nice crack. Now to get a complete division of two heminuclei, rotate 180 degree. Remember, rotate 180 degree and make a completely separated two heminuclei. Now each heminucleus is divided, again going through the substance of the nucleus, and midway between the equator and the center, the chopper is used to do this work, to divide the heminucleus into two large fragments. Sometimes it may not get separated at the central part, but we can manage once we get two completely separate two heminuclei. And now this is the other heminucleus. Again go through the substance of the nucleus, and this is how we manage the heminuclei. Two completely separated pieces have been achieved, and now tilt these pieces, start emulsifying from the apex, and this piece has been divided into two smaller pieces, and then this piece is being emulsified. Ultrasonic energy being used in this case is 90% in continuous mode. You can make out that this is ECT of Ophth cataracts, phacomations. This is Ophth cataracts easy. And this is the other piece. Again it is divided into two smaller pieces, and then emulsification is started from the apex. Once you start emulsifying from the apex, the smooth round edge of the piece rests on the posterior capsule. Actually, it guards the posterior capsule and prevents posterior capsular rents. And now we come to the other piece, other heminucleus. Tilt and start emulsifying from the apex. The pupil has become little smaller. It has become about 4 millimeter at this time, but you can still manage. We don't have to use a pupil expansion ring in this case. Up to 4 millimeter pupil we can easily manage all cases. If it becomes less than 4 millimeter, we should use a pupil expansion device, either a ring or iris hooks. And now this is the last nuclear piece. It is again divided into smaller pieces if necessary, and very slowly, very meticulous, in a very gentle way this piece is emulsified. At this time the vacuum can be reduced to about 200 or 250, and flow rate can be reduced to 20 or 25. Ultrasonic energy remains the same, about 80 to 90% for this hard nucleus. And very slowly, in a very gentle way, the last nuclear bits are emulsified. The antechamber is very stable, the posterior capsule is far behind, and we can emulsify in a very safe way. So we must increase our surgical skills to this level or above this level to give very good vision to our patients. After cortical cleanup, the case looks like this, and then a hydrophilic acrylic single piece monofocal intraocular lens is being implanted in this case. See how gently, how slowly the case is being done. This is an edited video. The total surgery took about 15 minutes. It has been edited to this 8 minutes. After implantation of intraocular lens, the case looks like this. We started from this stage and we have got a very good result. Thank you very much for your attention. Hope this video will inspire you to take off challenging cases, to take off hard cataracts for phacoemulsification. Try Submarine Chop. Be gentle, be patient, be slow, and be very caring for the patient. Give very good vision to the patient.